Hey there, welcome to GrowMed. Welcome back to another session where we are discussing 10 important topics from each subject. So yesterday we had discussed about the anatomy, and in this video we will be discussing about the forensic medicine. So there are various topics from the forensic medicine which are repeatedly asked, and by studying those points thoroughly, even in the last minute, you can score good from the forensic medicine. So I will be discussing now all those important topics. So the Medical Termination Act 2021, every year one question from this is there in the FMG. So last year also in the Jan there was a question on this, and you can expect in the next July exam. And what happens in this act? So this act, it was earlier 1971, given in the 1971. Then there were some changes made, and in the 2021 there are various new changes. So we will look at those changes because questions are asked on that. Now it covers the unmarried women also in this act. Then gestational age limit 24 weeks for the rape survivors, and beyond 24 weeks for sustainable fetal abnormalities, that is any congenital abnormalities. If they are present, then we can extend the medical termination up to 24 weeks, matlab more than 24 weeks, beyond 24 weeks. But normally we will be doing it up to 24 weeks nowadays. Earlier it was the 20 weeks of gestation. Okay, this one is an important point. So this has been asked in the FMG, the 24 weeks for the rape survivor, and also beyond 24 for the fetal abnormalities. Then questions are asked on how many doctors are required to do the medical termination and who all can do it this. So a doctor who is trained under a gynecologist and he has done 25 MTP, so he can do the MTPs. And a registered gynecologist, so who is a gynecologist, they can also do this MTPs. One doctor opinion is required before 20 weeks till 20 weeks, and opinion of two doctors required 20 to 24 weeks, and after the 24 weeks, beyond 24 weeks, medical board approval is required. Then moving on to breach of the woman's confidentiality. So fine, earlier it was up to the 1000 rupees, now it is fine or imprisonment of the 1 year. Then in the Jan 24 exam, this question was asked that on the Medical Termination Act, MTP Act, there is a medically ill patient, and based on that act, who will be giving the consent for the MTP, and it was the guardian. So this was about the MTP, which you must know. Then moving on to the inquest. Inquest is also very important, and repeatedly questions have been asked on this. So the things which you must remember from this inquest. This is of two types which we follow in India. One is the police and another one is the magistrate. And there's another third type of inquest present, which is the medical inquest. We do not use it in India, but this one is the overall best inquest. So let's look at the questions asked from it. So this one is the most common. Police is the most common inquest which we follow in the India, and the magistrate is the superior one. Then this is the number, and you need to remember this number. So for the police inquest, the IPC number or the CRPC number 174, and for magistrate it is the 176. So questions have been asked on this. So you need to remember these numbers. Then minimum rank in the police to do the inquest is the head constable, and the magistrate, it is classified into the two types, the judicial and the executive. So judicial means this will be done by the court of the laws, and the inquest done by the government officials, that one is called as the executive. So these are the difference between the judicial and the executive. Now let's look कि judicial में कौन सी आती है and executive क्या क्या करता है. So judicial में the things which come is the custodial death. Then executive में there will be the dowry death and the exhumation. Exhumation से questions related जो आते हैं, these are no time limit. तो exhumation के लिए इंडिया में there is no time limit. Exact code for this one is the 176(3) CRPC for exhumation. ठीक है. And dowry death, the punishment for the dowry death comes under IPC section 304B. So you need to remember these IPC sections also because they have been asked in the exam for example, McNaughton's rule, it is the IPC 84. Then for the abortion, criminal abortion 312, 313, 314, abortion with consent, without consent, and for the rape also. So some important IPC sections which you must remember. Then this was about the inquest. Then moving on to the test of for blood stains, and there are various tests carried out, and each test have a specific importance, so we will look at them. The first one, the spectroscopic test. This test is the most specific and most confirmatory test as a one liner. So they had asked a question that which of the following test is a confirmatory test for the blood stains, and they'll give some four options from this, and you had to choose the spectroscopic. Then moving on to the Kastle-Meyer, also known as the phenolphthalein. In this, the stains, blood stains will be giving a pink purple appearance. Then in the Takayama's test, there will be salmon pink feathery crystal. As you can see here, this one is the Takayama's test, and image based question can be asked on this. They will give this image, and they will ask that which test it is, and this test is used to stain which of the following. So they'll provide some options, and you need to choose the correct one, like the blood. Then Tickman-Hayman crystals. So this one is the test, the Tickman-Hayman crystal test, and in this you can see brown rhombic Hayman crystals. So these are the brown rhombic crystals which are appreciated, and image based question have been asked on this also. They'll give this image and they will ask that which test it is. Then benzidine test. This is the most reliable test and microchemical test used to see the RBC content. Then also this is a PYQ and asked as a one-liner, and the question was human blood in stains is identified by the precipitin test. And also this question can be asked in a different pattern, that you find some various blood stains and you need to differentiate between the human and the animal blood stain. So which test will you do? So it was the precipitin test. Okay. Then moving on to the test for the seminal stain. So this one is also an important topic, and questions have been repeatedly asked on the seminal stains. So Barberio's test. So as you can see here in the image, this one is the Barberio's test, and in this test the semen, it has a particular component, and this component will be giving this needle shaped crystals present. Image based question can be asked. Okay, then moving on to the other stains, fluorescence stain, acid phosphate test, fluorescence test, and the creatinine phosphokinase test. You just need to remember the names. No need to go into that detail because questions are only asked on these names. So they will give that which of the following tests are done for the seminal stains, and they will give this combination of these stains test and these tests, and you need to identify from it. Then blast injuries. So these are classified into the four types: primary, secondary, tertiary, and the quaternary. So primary, it will be due to the blast wave. So where the blast has happened, that area and that spot, that will be called as the blast wave. And in this, questions are asked that which organ is involved more. So which organ is the first to be affected? It will be the tympanic membrane and the lung. Then flying sharpness, this one is called as the secondary, because this is also called as a projectile, because where there is blast, so the things which are surrounding it, present surrounding it, like the car or the vehicle or humans, they can go and hit other people, right? So this kind of injury is called as the flying sharpness, and the injuries caused by it will be the abrasion, bruises, and the laceration. Then moving on to the victim displacement. Victim means the humans, so they also will be displaced, right? मतलब कि there will be humans present, and जो दूर के humans है, they will be like उनको भी झटका लगेगा and they will fall, and due to which they can have a fracture. Then miscellaneous. Miscellaneous में this one is classified into the quaternary, and this includes asphyxia and the burns. So you need to remember these blast injuries. Then moving on, coup injury and the counter coup injury. So coup injury means injury at the site of the impaction. So this is the definition, and questions are asked on the definition. So they will give that which of the following is true for the coup injury, and they will describe a few sentences. So this is the definition which you must remember for the coup injury. Like for example, this is the head and the impaction. This impaction is present on the right side. तो जहाँ पर impaction हुआ है वहीं पर injury दिखेगी. This one is called as a coup injury. Counter coup में क्या होता है कि injury opposite to the site of the impaction. तो इसमें ऐसे होता है कि this one is the head and यहाँ पर injury हुई है. But this injury will not be having here. तो opposite side में यहाँ पर होगा, ये दूसरी जगह पे होगा. And that one is seen in case of a mobile head. Like for example, जब भी कोई स्पीड में गाड़ी चला रहा है एंड सडनली देयर विल बी एन एक्सीडेंट, और एक्सीडेंट में क्या होगा कि हेड जाके जो शील्ड है उस पर टकराई, बट ड्यू टू द मूवेबल हेड तो इम्पैक्शन तो हेड पे फ्रंटल बोन पे आएगा, बट जो इंजरी है वो ऑक्सीपिटल बोन पे आ सकती है. सो दिस इज जस्ट एन एग्जांपल ऑफ द counter coup injury. So definition you need to remember कि questions are frequently asked on the definition. Then moving on to the cuts. So there are two types of cut. एक तो है hesitational cuts, also called as the intentional and the tentative cuts, seen in case of the suicides. And how do you identify this as the hesitational cuts? So there will be present on the accessible parts of the body like hand, then finger. सो विच एवर पार्ट इज़ ईजीली एक्सेसिबल टू द पर्सन, वहाँ पर ये हेजिटेशनल कट्स दिखती है. एंड अनदर इम्पॉर्टेंट फीचर ऑफ दिस इज इट विल बी मल्टीपल, प्रेजेंट इन अ मल्टीपल, एंड देयर विल बी सुपरफिशियल. तो ये ज़्यादा डीप नहीं होते हैं, जो वुंड है वो ज़्यादा डीप नहीं होता. इट विल बी द सुपरफिशियल वुंड, एंड व्हेन यू लुक एट इट यू कैन फाइंड मल्टीपल पैरेलल वुंड्स लाइक दिस. सो मल्टीपल पैरेलल स्क्रैचेस देखने को मिलेगी आपको हेजिटेशनल कट्स में. एंड इमेज बेस्ड क्वेश्चंस भी पूछे गए हैं इसमें. सो लेट मी शो इमेज ऑफ दिस वन. So as you can see here, the hesitational cuts, they are multiple and they are parallel to each other. Then homicide. Homicide matlab killing. So the kind of injuries seen with the homicide are the chop wound, genital injuries, then defense wound, overkill, and the beveled cuts, which are the oblique cuts. So a clinical case can be described. A person, he was having injury to the scrotum, and what can be the cause? So it will be the homicidal cuts. So question can be asked like this. So you need to remember these things. Okay, homicidal का मतलब क्या है और hesitational या फिर intentional cuts का मतलब क्या है. Then moving on to the toxicology. So questions are asked on the poisons and the antidote. तो clinical case भी दे सकते हैं या फिर they will ask directly one liner. So we will look at them. In case of lead poisoning, we will be using the antidote EDTA. Then in case of iron, desferoxamine. So this one is asked in integration with the pharmacology also, क्योंकि ये जो सारी चीज़ें हैं ये फार्मा में भी हम पढ़ते हैं, the poisoning and this antidote. Then in case of alcohol, it is the fomepizole. Copper, potassium ferricyanide. Cocaine, amyl nitrite. Opioids, naloxone. Cyanide, the antidote used is the sodium thiosulfate, and for organophosphate atropine, and snake bite neostigmine plus atropine. So these are repeatedly asked in the exam, and especially this iron and the lead one. These are the favorite of the FMGE, and frequently questions are asked on this desferoxamine. And a case दे देंगे कि a child had accidentally ingested his mother's iron tablets and comes to the emergency. Now which of the following antidote you will be giving? So it will be the desferoxamine, and यही clinical case बहुत बार repeat किया गया है, this child and mother's iron tablets and antidote. Then moving on to the cadaveric spasm. So this one is also an important topic, and image based question are asked. So this one is the image most commonly seen with the drowning. So when a person is alive at the drowning, that time you can see this phenomenon. So what is the cadaveric spasm? Spasm immediately after the death. This is also called as the instantaneous rigor, and primary relaxation is absent. So what happens in the rigor is it is the post-mortem contraction of the muscles. So there are various phases. First the muscles will relax, then contract, and then relax. And these all features occur due to the ATP. That means the first ATP will be present in the cells and sudden death will cause the relaxation. Later, due to the cell death, the ATP will be released causing the contraction, and then the ATP will decline. So there will be no ATP further, which will cause again the relaxation. And what happens in this cadaveric spasm is the primary relaxation phase is absent. So there will be contraction present, and by this we can come to know that during the death the person was alive. And this one is the image famously given with the cadaveric spasm and seen with the drowning. So we have already discussed another two important things about the rigor and the drowning and also the image. Then moving on to the superimposition, a favorite question of the FMG, so asked multiple times. So superimposition, it is a method of human identification, and what we do in this is we will take the skull image and we will put the image of the missing person on it. Like we will be superimposing both to match the face and the skull. And image based question is asked on this. So a similar image can be given, not exactly this image but a similar image wherein they'll be taking a skull and the image of a person and then trying to superimpose it. Then moving on to another two important topics, the abrasion. So the abrasions are the superficial cuts and the epidermis is involved. Only the epidermis is involved in it, and these are of two types, horizontal or the perpendicular. In horizontal we can see scratch mark and the graze. So scratch means a single wound or a single cut and most commonly seen with the pin or the needle. And gaze means there will be multiple scratches present and most commonly seen with the road traffic accident. So this was a PYQ and this is the image. It looks like this, the grace. Then perpendicular aberrations. So two types, pressure and impact. So pressure, the examples are the ligature mark or the bite mark. So this one is the ligature mark, and you can see here that due to the pressure of the rope in case of hanging, so whenever a person is hanging, due to the pressure there will be a mark present on the neck which is called as the ligature mark. And another example is the bite mark. Then impaction means this one, the tire marks. So these you can see here the tire marks and these are due to the impaction. मतलब कि sudden impaction हो जाएगा, बहुत force से वो आएगा ना. whenever a tire goes on to a person तो बहुत speed से जाएगा, जिसकी वजह से you can see this pattern. And this is also called as a pattern aberration because इसमें ना patterns बन रही है. You can see the pattern of the tire, so also called as the patterned aberration. Then questions are asked on its age, so let's look at them. If it is fresh or less than 12 hours, then the appearance will be bright red. 12 to 24 hours it will become reddish, 2 to 3 days reddish brown, 4 to 7 days brownish black, and more than 7 days the scab falls off. So this one is about the abrasions. Then moving on to the bruises. So this is also a kind of a mechanical injury and swelling can be seen in this and there will be bleeding due to damage to the dermal capillaries. Then types superficial, deep, and the ectopic. Ectopic examples are the battle sign and the raccoon sign. So you can see here that the battle sign and raccoon sign seen in the eyes. So this one is the eyes and यहाँ पर अगर bleeding होके वो swelling हो जाएगी, then that one will be called as a raccoon eyes. So what is the meaning of this ectopic is that it will be migratory. The battle sign जो है, there will be injury to the middle meningeal artery, so bleeding from that can come and settle down here in the posterior part of the ear, causing the bruises, and this one is called as the battle sign. So image based question also can be given on this battle sign and it asked in integration with the surgery and ENT also. Then the pattern bruises. So example is the sixpenny bruise and this is associated with the child abuse. So whenever you see in the question that sixpenny bruise is seen and in the option child abuse is given, then go with the child abuse because that is the answer. Then the age of the bruise. So how can we come to know that how many days the bruise is? So fresh, if it is fresh, then it will be the red color and it one is due to the oxyhemoglobin. Then from hours to 3 days, it will be bluish color. It will turn bluish color as you can see here, bluish purple, and this one is due to the deoxyhemoglobin. Then on the fourth day it will be the brownish, and that one is due to the deposition of the hemosiderin. 5 6 it will appear greenish due to the deposition of the biliverdin, and 7 to 14 day it will become yellow because of bilirubin. So this one is the appearance of the bruises, and image based question can be asked. They'll give the image like this one, so you need to see that this one is brown and bluish, so brownish and bluish, and they will ask what will be the day on which day this one will be appearing. So it will be appearing on the fourth day. So this was an example of the question asked from these bruises. So here we have discussed 10 important topics from the forensic medicine, which are also the repeat topics. So this was a short and a quick last minute revision kind of video for the from the forensic medicine. Watch this video at least 2 times so that you can come to know all the points easily, and if at all a question is asked on these topics, you do not make that answer wrong. So that's all. Thank you so much guys for watching this video. Stay tuned for more videos like this from the other subject also. If you're new to GrowMed, subscribe to GrowMed and tap the bell icon. Thank you so much guys. Bye bye.